There are over 25,000 operational primary healthcare centers in Nigeria, but most of them are hampered by workforce gaps, poor infrastructure, and lack of basic amenities. A visit to 14 health centers in some local government areas in Ogun State, southwest Nigeria, exposes the poor state of PHCs, especially those located in rural communities.
Kò sí òṣìṣẹ́ ní center, kò sí ògùn ní center.
Our wives and our mothers, they are suffering when they want to deliver.
With the population of this community, we need more hands.
This is Temitope Akinpelu, a hairdresser who shared a harrowing experience at a PHC in Ibeku, the community where she lives in Yewa North local government area of Ogun State. She said no personnel was at the Ibeku Health Center when she was taken to give birth one evening in August 2014. After an hour of waiting in labor pain, her family got a doctor in the community who later attended to her. Mrs. Akinpelu eventually lost the child 24 hours after the delivery, which may have been a result of prolonged labor, which according to the WHO is a common cause of maternal and perinatal mortality and morbidity. 9 years after Mrs. Akinpelu's experience, the situation has not improved at the Ibeku Primary Health Center.
Center ni kò sí àtúnṣe inú ẹ̀ rárá. Orí center kò dáa. Bí àwọn àlejò olóyún bá débẹ̀, máa ń jẹ́ ìnira. Kò sí bẹ́ẹ̀dì ní center. Ilé rí ẹ̀ kò dáa. Bàbá mú olóyún lọ pé kọ́lá bímọ. Bàbá débẹ̀, kíní ìdọ̀tí ó ti pọ̀ jù. Kò sí òṣìṣẹ́ ní center. Kò sí ògùn ní center. Gbogbo ẹ̀ ọjẹ́ wọn yìí ọjẹ́ ẹ̀dùn ọkàn yìí ni. Torí kò sí omi ní center ọ̀dọ̀ yìí ni. Ọ̀yọ́jì ni wọ́n bá bímọ. Àtúnṣe pé o ní olókadà ẹ̀ṣẹ̀ tó pọnmẹ́ ẹ̀ṣẹ̀ gbé lọ center. Fọlọ́mù kéde bí ọlọ́mù ń wẹ̀ òṣìṣẹ́. Bára òní kọ̀kọ̀ bá yá ni wọ́n bá débẹ̀. Àbúkọ́ sáré lọ kọ́ láàárọ̀ ògùn nígboro. Ọ̀dà abẹ́ wọn kọ́ bá ní ṣe àtúnṣe sínú ẹ̀.
Irú health center Ibeku yẹn, àkọ́kọ́ náà àwọn òṣìṣẹ́ tó wà ńbẹ̀ wọn ò pọ̀ tó. Ó yẹ kí ìjọba kàn sì bá wa gbé àwọn òṣìṣẹ́ wá tàbí kàn gbà sí àwọn òṣìṣẹ́ la lè jẹ́ káwọn tó ń ṣiṣẹ́ ńbẹ̀ kí wọ́n pọ̀. Ìkejì ni wípé àwọn ilé yẹn náà ó ń pè fún àtúnṣe. Ìgbà míì táwọn obìnrin bá dẹ̀ débẹ̀, kò ń fi bẹ́ẹ̀ sí oògùn tó fún wọn, kì í fi bẹ́ẹ̀ sí ìtọ́jú tó fún wọn. So ìjọba ní láti ṣiṣẹ́ lórí àwọn eléyìí kí kó má bàa di wípé à ń pàdánù ẹ̀mí.
Agbon Ojodu, Apetu, and Ojaodun primary health centers in the same Yewa North local government area also lack the required personnel, necessary drugs, and medical equipment in place.
If ordinary paracetamol, they need to buy it in a nearby pharmacy, which is not good, which does not sound well. So we are facing a lot of challenges when it comes to health.
The findings of this investigation revealed that the major challenges of PHCs in Ogun State are inadequate workforce and poor infrastructure. The National Primary Healthcare Development Agency recently disclosed that only 2% of 25,843 operational PHCs in Nigeria have the required skilled birth attendants. The agency, in a publication titled Minimum Standards for Primary Healthcare in Nigeria, says an ideal PHC should have a minimum of 24 staff. Virtually all PHCs visited in Ogun State lack well-equipped laboratories and other equipment needed in standard health facilities. In Ajumo, Maidon, and Olambe PHCs in Ifo local government area of the state, residents also complained about the unavailability of doctors, skilled birth attendants, and the lack of basic amenities. Many residents also complained about the deplorable state of roads in major parts of Ogun State, especially in Ifo, Yewa North, and some places in Abeokuta.
Tá bá dé wò náà, living condition bíbá yìí náà ó wà somehow critical. So government ní láti ṣe àwọn ìrànlọ́wọ́ tó pọ̀ fún àdúgbò wa yìí bóyá ro ọ̀nà yẹn náà tẹ́ bá wo ọ̀nà tẹ́yìn gan gbà débi báyìí ẹ rí wípé kò dáa rárá. So all those things government gbọ́dọ̀ ṣiṣẹ́ lórí ẹ̀.
Know some of the difficulties we are facing, and our roads are not good. So for a pregnant woman to approach the health center is not an easy job. So we employ the government to do something in this direction.
In reaction to this investigation, the Commissioner for Health, Tomi Koka, highlighted the efforts of the government towards bridging the skills and workforce gaps in PHCs in the states.
They just interviewed over 80 nurses just last week. They're about to start. About 20 doctors about to start. If you come back in 6 months' time, 50% of them will be gone. We employed 40 last year. Not even last year. Yes, last year. Last year, we employed 40 doctors so that we could have one per LGA.
The commissioner said the state has also embarked on a massive infrastructural upgrades of PHC facilities across the state.
So talking about skill gap in primary health center, we really need to understand the fact that primary health center is the closest to the grassroots. It is the closest to the community. A lot of people would not walk into a teaching hospital just because of headache or because of some form of malaria. And really, the primary healthcare centers are supposed to speak to this. That do we have enough people to man the primary healthcare centers? The answer is no. First, even the teaching hospitals are crying that they don't have enough people. We have people who are training as residents, leaving the country in between their training. Even specialists are leaving. So we are left with medical officers who would work at the primary healthcare center. So
the primary healthcare centers is something that even the state governments, we know that is really the state government and local governments are supposed to work. There's a framework already that the federal government through the Basic Healthcare Provision Fund, where the federal government brings out 1% of consolidated revenue and leaves it for health to fund, health through the NPHCDA and the NHIS, and it comes down to the state's primary healthcare development agencies and the state's health insurance agencies. And I don't know how well that has been implemented. So that's somewhere we can look at, even to expand, even maybe the funds available in we can move from 1% to 2% and see how not just even services or infrastructure, but also manpower. Most of these PHCs are not well staffed or adequately staffed. So I feel like there's a lot of work that the government has to do.
Despite various government policies and interventions as enumerated by the Health Commissioner, the challenges that limit effective service delivery in Ogun PHCs still exist.
Investigations, special reports, analysis, and breaking news. Premium Times, a leading multimedia news platform, brings to you every minute stories that helps you make informed decisions and hold public officials, individuals, and organizations accountable. We have cartoons, videos, podcasts, and other interesting content for your delight. For timely update on politics, entertainment, sport, and business, visit our website on www.premiumtimesng.com and follow us on all our social media platforms. Don't miss out.